Last year, you could bite into ice cream without flinching. Now, one sip of cold water feels like a shock straight to your tooth. You look in the mirror and think, wait, were my teeth always this long? You're not imagining it. Your gums are quietly pulling back. I see this all the time. It starts small. A little zing here, a tiny notch there, and before you know it, your smile just looks different. So why does it happen? Why do gums decide to move in the first place? It's not just age. There's always a reason. And the good news? Most of the time, it's something you can actually control. Once you hit your 40s, your gums don't bounce back like they used to. The tissue's thinner, circulation slows, and little habits that didn't matter before, like brushing a bit too hard or clenching at night, start leaving their mark. Your gums didn't suddenly give up. It's just that all the tiny bits of damage from the past years are finally catching up. The upside? You can still stop it, right now, if you catch what's causing it and change course early. Let's start with something you probably do every single day. And it's probably happening right in your bathroom sink. When people get older, they often decide it's time to do better with their oral care. Brush longer, harder, more thoroughly. And that's great, but here's the problem. Harder doesn't mean cleaner. A lot of people switch to a medium or hard-bristled toothbrush thinking it'll scrub away more plaque. Combine that with extra pressure, and you've got the perfect recipe for gum recession. Those stiff bristles and that heavy hand scrape the edge where the tooth meets the gum. Over time, that spot wears down, the gums pull back, and your teeth start to look longer and feel more sensitive. The fix? Simple. Use a soft brush. Hold it lightly, like you're holding a pen. Angle the bristles toward your gum line and make small, gentle circles. You're polishing, not scrubbing. Give it a few weeks and you'll notice the difference. Your gums calm down and stay where they belong. Before we move on, quick thing. I know a lot of you watch these videos but haven't subscribed yet. If you've already learned something new, or this is helping you understand your gums a little better, hit subscribe or share it with someone who needs to hear it. It really helps me reach more people before it's too late for their teeth. All right, next, a sneaky reason your gums might be receding, and it's got nothing to do with brushing. If you wake up with sore teeth, tight jaws, or those dull headaches near your temples, you might be clenching or grinding your teeth at night and not even know it. And yes, it can also happen during the day, especially when you're stressed or deep in concentration. That constant pressure travels down to the roots, straining the gums and slowly pushing them back. Grinding can happen for a few reasons: stress, habit, or even misalignment. For now, let's talk about the first two. If stress is behind it, you've got to calm the body while you're awake so it doesn't carry tension into sleep. Try simple things: deep breathing, meditation, a few stretches, or even a warm bath before bed. A small trick that works: rest your tongue gently on the roof of your mouth and breathe through your nose. It relaxes the jaw muscles and teaches your body what relaxed actually feels like again. If it's more of a habit, your dentist can spot that during an exam and may recommend a custom night guard. It's like a cushion that takes the bite pressure off your teeth and gums. And if you catch yourself clenching during the day, ask about a thin, clear day guard, something you can wear while working or driving. Once that extra pressure is gone, your gums finally get a break. They can rest, and the recession slows or even stops. But what if your brushing's gentle, your bite feels fine, and your gums are still pulling back? Then it's time to look deeper, not at your toothbrush, but at what's happening under your gums. Gum disease is one of the biggest reasons gums recede, and it usually sneaks up quietly. According to the CDC, nearly half of adults over 30 already have some form of it, and that number jumps even higher after 40. In the early stages, you might notice a little redness, bleeding when you brush, or a bad taste in your mouth. Those are signs of inflammation. When bacteria settle along the gum line, your body reacts by pulling away from the irritation. Over time, that gentle retreat becomes recession. The good news? Early gum disease can be reversed. Your hygienist can clean away the buildup your toothbrush can't reach, and at home, brushing twice a day and flossing once keeps things stable. If it's already deeper under the gums, brushing alone won't fix it. Your toothbrush can only reach 1 to 2 millimeters below the surface. Beyond that, your dental hygienist needs to clean those deeper pockets. After that, your job is to maintain daily brushing, flossing, maybe a rinse your dentist recommends, to keep things healthy between visits. Now, in advanced cases, gums that have already pulled back won't grow back on their own. But that doesn't mean there's no hope. Some offices use laser therapy to encourage healing. Others do gum grafts to rebuild lost tissue. The first step is always to stop the infection. Then you maintain what's been repaired. When the inflammation calms down and your mouth stays clean, the tissue strengthens again, and that's when real healing starts. Now, this next one surprises a lot of people. Sometimes your gums start receding not because of brushing or bacteria, but because your teeth just aren't lined up the way they should be. When your bite is off, certain teeth take more force than others. It can happen from crowding, spacing, or teeth that have slowly shifted over time, maybe after a tooth extraction. That uneven pressure builds up. The gums around those overloaded teeth thin out and pull back, while the rest look perfectly fine. And this part confuses a lot of people. They see recession on 1 or 2 teeth and assume it's from brushing too hard. But think about it. You'd have to brush those same 2 teeth extra hard every single day for years to cause that kind of damage. That pattern usually means the bite's off, not the brush. When the teeth don't meet evenly, every chew and every clench sends stress straight to those gums. Over time, that pressure weakens the tissue and makes it pull away. The only real fix is to realign the bite. Orthodontic treatment, whether clear aligners like Invisalign or traditional brackets and wires, evens out the force across all your teeth. That balance protects both enamel and gum line. Once everything's aligned, the gums stabilize again. And the sooner it's corrected, the better, because the longer things stay uneven, the harder that damage is to undo. Now, you might be wondering, what if your dentist says your gums and bite are fine, but recession's still happening? In that case, it's time to look beyond your mouth. Some of the biggest culprits are everyday habits that dry out your mouth and slow healing. Smoking, alcohol, even dehydration. When your mouth's dry, saliva can't do its job. It's your natural defense system. It washes away acids, balances bacteria, and keeps tissue strong. Without it, gums get fragile and more likely to pull back. Certain medications like blood pressure or allergy pills can make this worse by reducing saliva flow. And if you mix that with smoking, you've basically turned off your gums' ability to protect themselves. Here's what helps. Stay hydrated, use a humidifier if you sleep with your mouth open, and cut down on alcohol and tobacco. If medication's drying your mouth, ask your dentist or doctor about saliva substitutes or adjusting your dosage. Even small things, sipping water often, chewing sugar-free gum, can make a real difference. So if you've started noticing your gums creeping back, don't panic. The earlier you catch it, the easier it is to stop. And even if you're further along, you can still protect what's left and keep things from getting worse. Start with the small stuff. Soft toothbrush, gentle pressure, regular cleanings. Protect against grinding, stay hydrated, and keep an eye on your daily habits, the ones that seem small but make all the difference. Receding gums don't happen overnight, and they don't heal overnight either. But with the right care, they do get better. If you know someone who's always complaining about sensitive teeth, share this video with them. It might finally explain why. And if you have questions or want me to cover something specific, let me know in the comments.